So also, lower back pain is also one of the largest contributors to disability. So a lot of people really, as they age, get low back pain, and they can be a factor to disability. So 56% among middle-aged teachers already have experienced low back pain. Now, the wonderful thing about low back pain is that it is addressable. So there may be conventional treatments, and those that have actually experienced non-pharmacologic approach, such as yoga, massage, acupuncture, showed um, an increase in back pain relief. So without further ado, I just would like to consider some house rules. If you can please just mute yourselves in respect to the speaker, and then you can unmute them. I will be monitoring the chat box, so if there are any questions, we will address them. So it's very, very informal. We'd like it this way because as we discuss things, it will more on a personal basis. So I'd like to introduce Dr. Hector de la Cruz for the LAMP lecture series on low back pain.
Thank you very much, Dr. Baldomero. Let's get started. And we hope that everyone will enjoy today's presentation. Okay. This is actually a quick and comprehensive approach, so expect everything to be fast. And for today, we shall be tackling the etiology, the pattern identification, and of course, the acupuncture treatment. Let's start with etiology. Among the diseases that lead to lower back pain, pathological lesion of the soft tissue is the most common, okay, secondary to diseases of the joints. And there are fewer incidences of lower back pain that are the result of vascular pathology. And overstrain injuries are most commonly encountered in soft tissue pathology. Acute lumbar sprain is most commonly caused by indirect external force from improper bending postures and exertion of force. Chronic lumbar strain is usually caused by prolonged bending, improper postures, and congenital malformations. So perhaps you would like to know the difference between sprains and strains, okay? So a sprain, as indicated here, is actually a stretch or tear of a ligament. So I would usually remember L as for sprain, SPL, okay, which provides joint mobility, while strains are actually stretches or tears of a muscle or tendon in the area where it is turning into a muscle. Another cause would be an integrated facet syndrome, which is often due to injury and subluxation of facet joints during exercise or weight-bearing activity. So when you do workouts, you need to be very careful. Injury of interspinous and supraspinous ligaments, which occurs with every time you do twisting motions or when there are sudden changes of posture. Another cause would be integrated lumbar transverse process syndrome, which is usually caused by tension or muscle spasm at the waist and back due to labor or attack of wind cold. Sprain injury of joints and partial dislocation or subluxation or semi-luxation. This is caused by imbalance of force on the muscles from, again, improper posture. Damage of superior cluneal nerves, which is caused by sudden rotation to the right and left side. So please be careful when you rotate to the right or left. It might damage your superior cluneal nerve and will give you a lot of LBP. Piriformis muscle syndrome is caused by overstrain of piriformis muscle. And I'm sure our students in anatomy and physiology are very familiar with this muscle. Sciatica. This is caused by interstitial neuritis or compression of sciatic nerve. Then we have the prolapse of the lumbar intervertebral disc. With increasing age, the lumbar intervertebral disc may degenerate. No? It will show atrophy and show a decrease in elasticity, which can lead to protrusion of the intervertebral discs. According to statistics, about 90% of disc herniation takes place between L4 and L5 and L5 and S1, which may bear the most stress of the body. Many cases occur between the age of 24 and 45 years. Now let's go to the TCM causes. Number one is cold damp or cold dampness. This usually happens when you reside in a damp or humid locale, or if you happen to live near the beach, and sitting or sleeping on damp ground, exposure to the wind while sweating profusely from physical exertion, wading in water, or walking in the rain. They all risk cold and dampness that will lodge in the meridians and channels of the lumbar region. When this impedes the movement of qi and blood, then low back pain will result. Another TCM cause would be damp heat or dampness heat. Invasion by dampness and heat, they occur most commonly in summer. Persistent cold dampness can transform into heat. So that's something that not everybody is very familiar with. In either case, dampness and heat also impede or obstruct the lumbar meridians and channels. Another cause would be chi stagnation and blood stasis. Blunt trauma to the lumbar region can precipitate impedance of chi and blood circulation, which in turn can lead to blood stasis. And this gives rise to low back pain. And the last one is depletion of your kidney jing or your kidney essence. Depleted kidney essence is unable to nourish tendons and channels in the lumbar region, and this can lead to low back pain. Depletion of kidney essence may result from inadequate innate endowment complicated by overstrain, weakening by protracted illness, senescence, or unrestrained sexual indulgence. So to summarize, the TCM causes of LBP are cold dampness, dampness heat, chi stagnation, and blood stasis, depletion of kidney jing. Now let's go to clinical manifestation. It can be one-sided or both-sided. And uneasy sleep, restlessness, and anxiety may accompany severe low back pain. Key points of analysis. This is something that every practitioner should bear in mind. So first, we need to differentiate. It is a deficient condition or an excess condition. So when you talk about low back pain, you would have to qualify, is the condition deficient or is it excess? Low back pain due to attack by exogenous pathogenic factor or trauma, it develops rapidly. So this will manifest as blood stasis that will obstruct the channels. So this is obviously excess. And low back pain due to senescence, overstrain, internal injury, this will manifest as kidney deficiency with loss of nourishment of the lumbar region. So this is a deficiency condition. But most cases of chronic low back pain are actually a mixture of excess and deficiency. So with the kidney essence deficiency or chi and blood deficiency as the root, and the blockage of the channels by the pathogenic factor as manifestation. Next, we have to take note of the quality of the pain. Okay, so if there is intermittent aching weakness of the waist, so aggravated by strain, so when you do something that's really forceful, that's a bit, taking a lot of your energy. So this is depletion of kidney essence, poor nourishment of lumbar region. Stabbing pain in a fixed location, accompanied by a gray complexion and a bluish tongue, is mostly due to chi stagnation and blood stasis. Low back pain that is burning in quality and aggravated by warmth. So if the pain gets worse by warmth, and then when you look at the tongue, it happens to have a yellow and greasy tongue coating, and the pulse is rapid, so that's definitely damp heat that will gel and impede chi movement. Low back pain that is cold in quality, and the pain gets worse on rainy or overcast days. This is mostly due to cold dampness attacking the lumbar region and blocking the meridians. So for our, this will definitely help people who love to do wellness missions. So we would always consider looking at the general points. So I'm talking based on experience. So we need to look into bladder 23, an extra point Yaoyan, and bladder 40. For severe cold dampness, we add DO3 or governing vessel 3. For blood stasis, we add GV26. For kidney deficiency, kidney insufficiency, we add GV4 and spleen 6. Okay, let's try to be familiar with some of the points. Okay, bladder 23, we all know is the back shoe point of the kidney. We consider this for edema, impotence, or infertility. And this point strengthens and warms the patient's jing. And we all know that when the jing is depleted, this can give rise to a depletion of energy, depletion of wisdom, determination, willpower, and drive. And the use of moxa here can be effective for coldness in the bones, lower back, or knees. Yaoyan, or lumbar ice, is an extra point. This is located on the lower back in the depression, 3.5 Sun, lateral to the lower border of the spinous process of the fourth lumbar vertebra. It benefits the lumbar area, strengthens the kidneys, and alleviates pain. And bladder 40, we're all very familiar with bladder 40. It is called the Hussey point of the urinary bladder, command point of the low back. It is also called a Madanyang heavenly star point and an accumulation point of blood. This important point, bladder 40, can bring stability and equilibrium to an anxious, disoriented, or fearful person. Okay, I used to have patients. Most of my patients who belong to the 60s, 70s group usually have this kind of constitution. So it is helpful after osteopathic manipulation. So for the LMTs, for the osteopaths, or for those who are doing bone setting, can make your patient feel happy if they do bladder 40, because this can either free the rigidity in the spine where you sedate, or you tighten it up where you tonify. DO3 or governing vessel 3 is called the lumbar yangi. This is a passageway from the loins through the gate of life and eventually to the head and brain. And this is useful if the patient cannot bend from the knees, or the patient may have arthritis or rheumatism in the lower limbs, or for those with cold feet. So when you do moxibustion here, this will warm through to the abdomen and the lower jaw, and this is helpful for fear around sexual intimacy or for male sexual weakness. Do 26 is the crossing point of the dumai, renmai, large intestine, and stomach. It is called a ghost point. This is a powerful point that goes to the very center of our being, as it sits between the nose, because in Chinese medicine, the nose receives the heavenly qi, and the mouth, which receives the potential for earthly qi, with the humankind in the middle. So GV26 is used as a resuscitation point for loss of consciousness. Do 4. This is called the gate of life, gate of destiny, palace of Jing, or palace of essence. It is also the second youth point, center of vital warmth. This is excellent for those with a weak constitution. Consider using GV4 early on in treatment for bringing back vitality and energy to a person who is lifeless, cold, with no joy in life. Consider the use of moxa, particularly for cold-related problems, taking care not to overheat a person who is excessively hot. Kidney 3 is the yuan source point of the kidney meridian, shoestring point of the kidney meridian. Kidney 3 has a strong connection to the original yuan qi. We consider this for lack of will, for those who are excessively driven, or for hypertension. And when you palpate kidney 3, this is often tender if there is imbalance. Okay, we use filiform needles, apply the reducing method if the condition is excess, and the reinforcing or tonifying method if deficient. Moxibustion or cupping may be applied as appropriate. For ear acupuncture, aside from the options that we have presented earlier, because honestly, I would prefer the ear, especially if the patient has aversion to needles. So you might want, if you do body acupuncture, you might you do the additional ear points, the lumbosacral vertebra, shenman, and kidney on the same side or on the affected side. We retain the needles for 30 minutes, treat daily. After each treatment, you advise the patient to move the waist cautiously. So these are the points: lumbosacral vertebra, the shenman, and the kidney. So we advise everyone to equip yourself with the angled probe. And I tell you, the patient will be very happy if you do. So before needling, it is very important that we are very accurate with our points, especially on the ear. Okay. Avoid long-term fixed postures or repetitive motion based on a single posture. For example, squatting after prolonged periods of standing can relax the muscles of the waist and legs and reduce the consumption of energy. The patient should pay attention to their posture when lifting heavy objects. So they have to squat with the knees bent as they approach the object to avoid bending at the lower back and overloading it. And finally, obese patients should lose weight to reduce the burden to the lumbar region. Thank you for your attention. We're finished.
Oh, thank you, Dr. Hector, for that wonderful explanation. As a matter of fact, it's very simplified. We're in, even if you have a current problem for lower back pain, it could actually be addressed. I've experienced lower back pain myself, and I've come to you for treatment, and things was the difference between night and day. So thank you for that. I don't see any questions in the chat room or in the chat box. If you don't mind, just open your mic. If you have any questions, you'd like to share anything, if you've experienced lower back pain, which I'm sure you probably have at a time or two, and then what interventions you resorted to. This is we're here in an open discussion.
Okay. And it seems that nobody is asking any questions. Okay, what we are presenting today, we do not want to give you long lectures because I know some of you subscribe to Acupuncture Matters. I have a very lengthy discussion on low back pain consisting of several parts. You might want to take a look at those videos, but we're talking about a quick and comprehensive approach, so everything should be done fast, diba? Okay. Okay, wag po kayong mahiya. We can ask any questions in Tagalog, in Bisaya, or whatever. So, I hope everybody learned anything today. So, while nobody's asking, we would like to invite again everyone, kung hindi pa kayo nagsasawa sa amin, next Saturday at 5 o'clock, we're going to do Acne Vulgaris. So, allow me to plug it as early as now. I'm very excited because um, the patient that whom I have been working on has agreed to guest live, and I've been working on him for the past 7-8 weeks. So we have, parang I saw something written on the.
Oh, I went and reposted the facts about low back pain, especially from the Philippine statistics standpoint.
Okay, so when nobody's asking questions, we would like to thank everyone for really finding their time to attend, and we're very sorry if you expected a long lecture. It's out of our vocabulary. Knowing Dr. Ryan, he hates lectures longer than 20 minutes. So I was very careful not to exceed the time. Okay. Anyway, all of us here, Yeah, most of us. There are some who have not even studied acupuncture for like a year. And one example is our moderator for today, the host. What someone has learned for a year and a half, he has learned in about a month. Ay nako, you'll be amazed. I don't know how he does it, but I think his ability to speed read has a lot to do with it. And can you imagine if you have a patient like him? Um, you will always be on your toes because he will always double check if what you were saying as facts are indeed facts. Thank you po, Ma'am Betty. Puro man tayo, thank you. Ay, pinapaalis na si Ma'am. Okay. So, any announcements? Okay, by the way, for those who are excited, we'd like you to try. This is based on personal experience. I know there are many of you who have other points, but I don't want to overstimulate my patient with too many needles. Although sometimes we are tempted to do so just to justify their the fees, no? But again, a very good practitioner will only needle which she feels is most important. And I would like to tell everyone that your relationship with the patient is very, very important because there is always a possibility that he can be your best referrer. No? Okay.
And
Yeah.
just to add, having experienced ear acupuncture most often as a week, I could say that it does, if we practice ear acupuncture, it will put body acupuncture in the limelight. And the reason why I say this, because it's very accessible. Second, the patient could only be sitting down while you're
Yeah.
doing the ear or doing therapy on the ear. And then second is that the ear represents all the meridians that you have. So it does require
Mm.
um, precision and it does require skill. And that's what Dr. Hector and I found out, that your angled probe is
Yeah.
really a huge tool that you can use in locating those points.
It is very indispensable, actually. Yes. We will not tell you where to buy it. Be resourceful. You can ask us. Very affordable. And, accuracy is very, very important. And educating your patient counts a lot. There should always be an effort expended on teaching your patient how to look at the tongue because if the treatment was very effective, if the patient would like to see you again for future sessions, you should see a change in the tongue picture. Okay? So if the coating of the tongue was too thick to start with, then you should expect a gradual improvement. I'm not saying that you will immediately have an abrupt thin white coating. It doesn't happen that fast. But again, uh, your uh, your patience in educating the patient is very, very important. I sometimes ask my patient to take home some needles, which he can needle on the ear, because I know it's not illegal to do ear needling. And that's one way of showing the patient that you care. And for all you know, the next time he comes back, he would bring a friend or even the whole family. And that's what happened to Dr. Baldomero. Now I ran out of patients because he would treat his family himself, although he would see me regularly for his weekly sessions. And he would pay.
Because I know the cost of the needles.
Oh, yeah. He also has can you imagine having a patient who even owns an electroacupuncture, buys all the type of moxa? Ano pa ba yun? And why do you like press needles? The pan,
Oh, no, yeah,
yeah,
I'm very partial to press needles in the ear.
yeah.
I prefer it more than the ear seeds. And the reason to me is that if you actually hold the press needle in there for 2 to 3 days or five showers, it has a more, I would say, lengthening effect, or it prolongs the therapy. although it is though not for everyone, because there are
Yeah.
some points that really need to be addressed, like when you lie on your ear. And sometimes, that's one of the biggest problem is that the ear becomes sensitive.
Mhm.
So if they can, I leave the press needles, and if they cannot tolerate, I'll tell them to take it out right before they go to sleep. So, and although they are, I mean, I'm very transparent. Although they're a little bit expensive, but to me, they're very
Okay.
accessible. To me, they're very accessible, and of course, they're very convenient. Because once you
Mhm.
put it there, you can hardly notice from a standpoint that it is there until you stimulate your ear.
Yeah, and Dr. Baldomero changes his needles, breast needles every day with a new one. Okay. A
Hi,
little
Doc.
bit, yeah.
Yeah,
Question
just
ba?
want, no, I just want to share lang.
Oh,
Ah,
Last
sige po.
February, yeah,
Pakita ka
last
naman ng mukha mo.
February, ay, wait lang, Doc. Here. Hi. Dito ako sa Lampe. By the way, I
oh,
just want to share lang, last February 25, I went in Dumaguete. Then before ako bumalik ng Cebu, Dr. Hector treat me, no,
Yeah.
using auriculotherapy, ear acupuncture. Because of, aside sa lower back pain, I have my hypertension. Okay, my BP that time is 146 over 100. Then after the treatment, it's only ear acupuncture by Dr. Hector. After that, a couple of minutes, then we check again our BP. My BP is nag-drop siya from 146, naging 120 over 80. So kaya nakaka-amaze ang auriculotherapy.
To be
Yan, Doc.
honest, it was a hit and miss. Di ba? We let's be humble naman ng konti. Hindi naman
Yeah,
una,
yeah,
yeah. Because I think everyone could see the constitution of the president of LAM, si Sir Albert, the real president. Okay. Yeah, as you can see, medyo he belongs to the yin deficiency uh, category, diba? So you would be looking at someone who has to take good care of the liver and the kidney. And I don't know if he would allow us to inform everyone that he loves the bottle. He loves. Ay naku, nahuli kita ha, umiinom ka. And also, I've noticed parang the sleep is not very good. So, uh,
correct.
buti na lang bumaba yung blood pressure. So it's definitely a case of liver yang rising. And you need to have a full grasp of the 5 elements and ano pa ba yun? Yung mga body, all the others, yeah, yin yang, to be able to understand and what really happened. So in treating, like the points that we used on Sir Albert will not be the same points that we will be using on Dr. Baldomero, just in case his blood pressure shoots up. So what I'm saying is, this is a customized approach
mhm.
to be able to really make your treatment effective. You need to be able to know the patterns. No, Nako, pattern identification is very, very important, and I hope you had a great time. Kahit maikli lang, understanding, because you won't be able to find the pattern weaving or pattern identification very exciting if you do not have any prior background on tongue diagnosis and the pulse. Importante po yon. So, of course, being the president of LAM, si Dr. as if Sir Albert, who is very hardworking, the lifeblood of LAM actually. So magre-resign na po yung present president because of old age. He felt that his pulse was really not in sync
Mhm.
with a normal person. So, di ba nakita mo nag-change talaga siya, even the
Yes, Doc.
yeah.
Yan, nag-change siya. Actually, because siguro wala rin akong kulang talaga sa sleep, lack of sleep. Because from Manila, then Cebu, then going to Dumaguete. So talagang pagod.
Yeah, and the food, di ba?
Yeah, sarap.
Yeah. Okay, so yon. Um,
May question dito nakita, Doc.
yeah, okay, sige, go. I hope I can
Ano
answer.
daw ang pwedeng unang gagawin daw for bone setting ba daw or acupuncture by Sir Arnold Lampa?
Ay naku, bakit ako ang itatanong mo? I don't do bone setting.
Actually, based on our experience sa mga wellness mission na kasama namin ng mga bone setters or chiropractor,
Mm-mm.
mas mabilis nilang namamanipulate
Mm.
ang pasyente
Mm.
kung i-acupuncture muna and then bago i-bone set, mas mabilis siya. Based on sa mga nakita ko na ano doon sa wellness mission.
So, yeah, sa
So,
tingin ko nga, no?
yeah, especially kung may mga scoliosis, ang ginagawa ng iba is nagba-backsu, then after backsu, tsaka nila minamanipulate. So,
Wow.
yun, nagiging maganda ang result.
Yeah, that's good to hear. And also, para mas ma-excite yung lahat, we're going to share with you probably in the future how we make other people look young using cosmetic acupuncture without using needles on the face. Are you excited?
Yes, oh, excited.
We just use the ear and other things. Ay, naku, ma-amaze po kayo as in. Dito lang sa amin.
Actually, Doc, nakaka-amaze talaga yung the next topic mo because I saw your
Oh, ay, yeah,
patient
yeah.
during yung sa Dumaguete, no? And talagang nakaka-amaze kasi I saw yung first picture niya, then after the series of
Yes.
treatment, oh, nakaka-amaze na akala ko kung may nilagay na iba pero more on
Wala.
ear acupuncture lang.
Yeah, after spending Dr. Ryan also I was proud to introduce him to Dr. Ryan kasi you know naman if you get nod, the precious nod of approval from Dr. Ryan, that means what you must be doing is right. And so he saw for himself. So if he had the time, I would always make sure na magkikita sila every session. Yes. So mas mabuti yon kasi siya mismo will be here with us same time next week. And I know you will have questions. Ay, ano to? Ay, grabe naman si... Okay. Talagang may reference. Okay.
No, somebody requested for the references, so I
Yeah.
went ahead and shared them.
Okay. Yes. I don't know if everyone will agree with me as to the points that we use. I'm a minimalist. I don't use too many points. Although I love to use more points, especially when I'm experimenting. Exciting talaga.
Yes, Doc, like what you did to me, a little needle lang yung nilagay mo eh.
Yes.
Nasa ear ko. I remember the liver 2, the bladder 23.
On the ear, yeah.
Yeah, on the ear. So talagang nakaka-amaze lang.
Mm-mm. Thank you. So sana na-maintain natin yung ano mo, 130/80, 130/.
Yes, Doc. No soft drinks na.
Yeah, so I think yan din ang isang reason why, okay, yeah, I know now. Humihina yung spleen mo, so that makes your liver very, very strong. So tumataas yung BP. Thank you po, Mama Marites.
Yeah.
Ano ba to? Yeah. Wala talagang tanong. So I guess...
Dr. Hector, it's Marsha.
Oh, yes.
I better go put my video on.
Sure.
You know, when you're reading like those ebooks that you gave us during our training, like for example, Skaya Abati's book or something like that, she would have like suggested points for certain conditions, like for example high blood pressure, and she could give you like 11 points or something like that.
Yeah.
And then she says you don't all need to use those 11 points. So I really need to learn how to see, I mean, like with the tongue or something like that, or some other way of figuring out to make so that I know which of those 11 points to use, right?
So would you like me to give you a crash course on... It's so
Like
easy.
right now?
Yeah, okay. Okay. If you are in pain, what does being in pain mean? That means there is an impedance or an obstruction or uh, there's a problem with the circulation. So your goal is to actually move the blood or invigorate the blood. Okay, so this is where your knowledge about the point categories comes in. So we would be always looking at the she-cleft points, or you might want to use points that can bring you a lot of energy so that you can, or probably really, really know what's causing the stagnation. Okay, like if someone is in pain, you would always notice. First, I would like to look at the tongue. The tongue would usually look purplish, or it just doesn't look good. No, it doesn't look like the normal tongue. And the pulse would be either choppy or fine. Okay. And you need to qualify whether it is chi stagnation or blood stagnation. Chi stagnation, the chi stagnates, there is pain that would love to travel. It's migratory. The moment it becomes blood stagnation, because this is chi stagnation that was uncorrected, untreated, so definitely when the chi stops, the blood also stops moving. So this is where the patient would already have pain that is fixed, that is stubbing, okay? So it's something that makes the patient really see a practitioner. So we look at a tongue that is probably bluish or very red, depending on the etiology, and purplish, yeah, reddish purple or bluish purple. Then feel the pulse, okay? The pulse is fine because of the deficiency, or it could be choppy because there's not blood flowing, okay? So the goal is to actually relieve the patient of the pain, but without disregarding the root. Okay, so what is causing the stagnation? Is it because of the phlegm? Is it because of the cold? Because exposure to cold can actually congeal the blood. Okay, and also, I'm not talking about being just exposed to cold. It's the kind of food that you eat. People these days believe that if the weather is too hot, it is okay for them to eat something that's cold, something that's, very damp. So initially, these foods, which are damp cold, will give you cold, but eventually, this will turn into heat. And that's where got, uh, things become more problematic. Okay. So there is always the need to learn about the she-cleft points, and it's a matter of determining what particular Zangfu is actually involved. Therefore, there is a need for you to be able to have a bird's eye view of all the channel of all the. Remember, there's a difference between the channels or the meridians and the organs themselves. Okay, when it's the organs, when the organs are already affected, then definitely you will have tenderness on the back shoe points. That means the pathogen, the pathogenic factor is already interiorized. And when that happens, then everything, of course, it will be chronic, and it's something that need to be addressed. Okay, so it now depends on the clinician, on the practitioner. Like, will he do uh, simultaneous treatment of both the root and the manifestation? Or will he be doing only treatment of the manifestation first because he could hardly breathe, and then probably treat the cause later? Or if the patient is feeling okay, you might want to do uh, tonifying the deficient organ first, because if one has a stronger immune system, then the pathogenic factor doesn't have to be eliminated, because eventually he will be strong enough to get rid of what we call the Sia chi, or the pathogenic factor, pathogenic chi. So it's basically a balance of eliminating the pathogen or the pathogenic factor and tonifying the upright qi or the gen qi. So there is really a need for all of us to know the basics. Okay, we have given you books. I'm very sorry because not all authors will give you the same information. It's still all up to us. Okay, we are not Europeans. We have a different culture. It's also the food that we eat. So these are the things that we have to consider. Ma'am Marsha, we're looking forward to, hopefully we could go to Bohol. Are you in Bohol now or in Australia? Sydney?
I'm still in Australia at the moment, but I will be back in Bohol in May. So whenever there's any missions in Dumaguete, Bohol, or Cebu, let me know. I need more practice.
Are you not going to invite us to, you're in Melbourne now?
no, I'm in country New South Wales. That's where I am. I
Oh,
live in the mountains. Yeah,
I
but
love the mountain.
yeah, but each time I attend a workshop, I realize I need to study more. When is this ever gonna stop, Dr. Baldemero?
No, it's a continuous learning process. I kid you not.
I
I feel I need to learn more every time I see something new.
Yeah, I know. Yeah, I learned a little bit, and then I realized, oh shivers, I need to learn more. Oh
But
gosh.
one thing,
I don't
one
really, yeah,
I,
can I interrupt, Dr. Ryan?
uh,
I was really amazed at how Dr. Ryan study. I don't know how he does it, but it seems that he would look at the case first or the presentation, and then he would do a background. Like it's, how do you call it?
that was
Ret
retrograde learning.
retrograde, whatever. I don't know if you can do that.
And also, Marsha, one of the things that I found out is that the points repeat themselves. Like in most cases for
Mhm.
stagnation, there's some common points that would apply. And then when you look at deficiencies like yin deficiency or yang excess, the points do repeat themselves. So you don't have to relearn everything. One of the things that really would help is knowing the patient, not only looking at their tongue, but also, you know, the patient's constitution. Just there's no such thing as treating somebody, what do you call this, like a teleconference thing, because you'd have to take a look at their tongue, feel their pulse, and then just look at the whole constitution of the patient. Just by looking at them, you can really tailor. It could be down and narrowed to like 3 or 4 points on the ear, and that's why you know, I'm a huge proponent of auricular medicine.
True.
And thanks to Dr. Hector for introducing me to this world.
And thank you, Lord, for giving us somebody who is so amazing. I don't know how he does it. It's just that he studies fast, he learns fast. Wow, what a talent. No. Okay, so and he's one person whose credentials are beyond
No,
beyond somebody
I'm just me. I'm
seven
just me.
pages. Oh,
I just like to read and learn.
yeah, so how I wish we can be like him. Anyway, Mom Marsha, I understand the predicament that you're in. We would like you to fall in love with TCM. I hope you like this kind of thing. Um, you might learn a thing or two by going back to our video, like in
Mhm.
low back pain. There's a lot of people who come in with low back pain, and you might want to even review our presentation last Saturday, the other Saturday, on shoulder pain, shoulder problems. Okay, because I believe that it's important that we do everything fast, short, and it's up for you now to read more. Because I have had experiences like where you give a very lengthy lecture and 5-10% just is absorbed, and so you don't get to learn anything. What matters most is you're exposed to the real world, and thank you for showing your interest in auricular medicine. In fact, we would like to call it the lump auricular preventive medicine. This is not simply sticking needles on the ear. This is not simply knowing the points for relieving anxiety. To be able to learn lump auricular preventive medicine, you need to have studied also the basics of acupuncture and TCM. Okay? So, because how can we be of service to people if our knowledge is so superficial, so shallow, so moronic, no? So so we need to really, really have a very analytical mind. We have to be like Dr. Ryan Baldomero, who reads fast and he wants it this way. I hope everybody liked our presentation. Perhaps some of you were surprised why I finished in 15 minutes. Okay.
Mhm.
So expect the same thing every time we meet. So, and we're very, very happy that even if we have this, oh, we would like to, yeah, I'm sure Dr. Mercado, our dermatologist, who is also an acupuncturist, would be very excited to hear about acne vulgaris. We did not, ay nako, this is the catch. I did not needle the face, only the ear, diba? So, yon. And I need to invest a little bit. I did not charge the patient because he was my guinea pig. And I love the results. Of course, you don't expect it to happen overnight. There's no such thing. What is important is when you treat acne, you need to look at what's causing it. And it's almost always dampness, and you have to look at the lung condition. True enough, he had other issues, and now he's happy. He's 24, a social influencer. You see how we get people. Okay. Yeah, he has he talks well. He's a good host. So he promised to be with us next Saturday. Marsha, isn't that a motivation? Do this like Dr. Ryan, because he would read the case first, focus on what is important, and then read about the basics. So again,
Okay, I'll do it that way.
okay,
Instead of jumping from one topic to the other, I'll actually do a more
good.
consistent and
And
Yeah. If you
logical way of
at
studying.
first, Ma'am Marcia, it was a little bit confusing to me because there were so many references. One references would say this, one reference would say that. So I just stick to one reference that a colleague would endorse to me that worked for them, especially, coming from Dr. Hector, we stick to the one book for auricular therapy. And so from then on, we find that many ways of addressing the problem. However, it's really going back to the basics of looking into the tongue and the diagnosis because it is so important. And I couldn't stress as much. I'd like to borrow the words of Dr. Gavino. If the acupuncturist doesn't look at your tongue or feels your pulse, it could be boodle. Boodle means to say quackery. So that's the way I feel. I'm not imposing this on anyone, but the tongue and the pulse diagnosis is really, to me, one of the things that would tell whether the patient's pain or the patient's condition is brought by yin, yang, or any deficiencies at all. So, I'd start from there. I'd look at the case, start from looking at the tongue, and then learning the patient itself. And then before doing it, I only treat my family. And so far, I do them twice a week, and they seem to be very happy.
And yeah, we've been doing a lot of trials, and they seem to work. Diba?
I did try auricular therapy with my nephew on acne, and his face actually after like six
Cleared up.
sessions started clearing up. So it was more of dampness and
Yeah.
very deficient in.
Mm. Okay. Was that inspiring enough, Ma'am Marsha?
Yes, thank you very much, Dr. Hector, and thank you very much, Dr. Ryan.
You're welcome.
We hope to see you very soon, hopefully in Bohol.
Yep,
We'd like to go to Panglao one of these days.
I'll try to get Dr. Jeff to do something.
Oh yeah, yeah. I promised to
It's your
see him,
title.
but it did not materialize. Siguro this time. Yeah.
So I did take a
Yeah.
look at the chat, and then there is a announcement inviting all for Dementia Zoom webinar by
Oh
Dr.
yeah.
Weblin on March 11 and 18, 6 to 8 p.m. That's a Monday. There's a contact information there from Ma'am Leticia. And I did also share, for those that are interested, the link to the YouTube channel of Dr. Hector on tongue and pulse diagnosis. In that way, it's very simplified, and I really do appreciate him taking the time, because it's hard to learn tongue and pulse diagnosis if you don't see tongue.
Oh,
If you
yes.
don't take a look at the tongue, I mean, and compare it. What we do with our patients, that tell them how to diagnose
Mm.
their tongue. Do it
Yeah.
first thing in the morning in the light. Even it's as simple as a routine of looking at their tongue, like doing brushing their teeth.
Mm.
And by then they would know, whether it is what's going on with their body on that day, because the
Yeah.
tongue changes from any point in a
That's
day. So
very true. Okay. At this point, we would like to we would like to welcome rather, Ma'am Leticia Abuy, the real head of the Education Department of the Philippine Academy of Acupuncture, Inc. Okay, ginamit lang yung pangalan. Ma'am
Dito
Leticia,
ko.
good afternoon po. You look so young. My God. Okay.
Yes.
Please invite
Ano yan?
everyone to
Facial acupuncture yan.
yeah, it's a power webinar by Dr. Webster Lim, President of the Philippine Academy of Acupuncture, Inc.,
Yay.
and also the
Opo.
faculty head of LAMP. We're proud of it. And
Yes po.
we need to attend po, no? Because
Oh, hindi talaga.
you all do not want to have Alzheimer's. Invite mo si
Yes.
Leticia.
Opo. Everyone is invited for Dr. Webster Lim Dementia via Zoom. So, kahit malayo po kayo, kaya-kaya po. Basta may Zoom account lang po kayo. So, for non-members, sasabihin ko ba yung ano?
Oh, sabihin mo na.
Ah,
And then,
okay lang.
gawa ka ng group chat for kasi we are going to amend the rules, di ba? Sigurong this
Yes.
time we will welcome those who are undergoing training for acupuncture, di ba? So medyo may aayusin lang ng konti. And I'm sure Ma'am Leticia is so mabait naman to welcome all of you as long as you
Yes
will be
po.
part of our very prestigious PAAY. Ma'am Leticia,
Okay.
invite mo na sila,
Prestigious
gumawa ka
talaga.
na ng group chat.
Ganun po. And, actually, wala naman pong ano po ito. So, Western and Eastern po approach yung i-discuss.
Yeah, can you
So,
show your
everyone is
slides,
welcome. Ah,
Ma'am
Ay,
Leticia?
slides. Gagawa na lang ako chat.
Sige, sa
Hindi
chat
ako,
na we go.
hindi po ako ready
At
ngayon.
saka ongoing, tapos na ba yung ni Dr. Webb, yung ED,
Ay, opo, sa Monday
face to
na
face,
po.
for those
Pero
who live in
face to
Manila?
face. Opo.
Ituloy mo na.
Mm-mm. Thank you po. Okay. Sige po. Monday, Dr. Webb has also face-to-face lecture. It will also covers the Western and Eastern approach for erectile dysfunction. So kahit babae po, welcome.
Yeah.
Uh,
At saka may free
you
bed,
will,
di ba?
oo, may free kalabasa. Boss.
Ewan ko.
Free kalabasa balls.
Oh, di
Opo.
ba? Exciting
Pampalinaw
yan.
ng mata. Opo, pampalinaw ng mata.
Okay.
Hindi po,
And that's,
ano po, masaya po yung discussion po. Lalo na pag si Dr. Webster po.
yes, very top-notch lecturer as in.
Opo,
And
opo. Yun lang
also, we
po.
would like to invite, okay, we will ask them to ask for your friend request, ba tawag dyan? To request friendship. Leticia Abuy.
Opo. Isa pa po, yung kung gusto nyo ng Tagalog, we also have a lecturer na Tagalog po. For first aid and emergency, kailangan po natin din yan.
Okay, yeah,
Opo.
very
And
much.
exciting din po ang April natin because we will have a lecture face-to-face for scalp acupuncture. It's a series. Grabe,
Yeah,
ang
four-part
ganda.
series. Yes.
4-part series. Approve po yan ni Dr. Hector. Siya po kasi yung head. Hindi po ako.
Ikaw nag-approve noon.
Hindi
It's
po
something, ganito po yon. Okay, okay, dagdagan
Ang
na
dami.
lang Ma'am Letty ha. Scalp acupuncture, I know some of you may have second thoughts, but it's so effective, especially for people with motor issues, no? Yung hindi hindi makagalaw,
For
especially
stroke.
yeah, and also with those with sensory issues, okay? Yung sumasakit o hindi maka-feel. It's so amazing. And PAI is presenting 3 different modalities of scalp. At the moment, there are 10. So at least maalam nyo lang yung tatlo, that's something. And if I'm not mistaken, we have the Jiao, the very famous Jiao. It's almost the standard of scalp acupuncture. Then meron tayong INSA, the Yamamoto New Scalp Acupuncture, and also the WHO system of scalp acupuncture. And then meron pong papakisin natin mga ulo ng mga tao sa paa, sa ano. So that will be
We will
very,
have free acupuncture. So,
yes.
kung ayaw
You
nyo
can bring your
mag-aral,
patients, no?
opo.
O magdala na kayo ng
Oo.
ulo pagpunta nyo doon. And also medical mission. Yung medical mission, sabihin mo na Ma'am Leticia.
Opo, medical mission. Kaso kung member po ng PAI,
Okay. So
opo.
mag-member muna sila. So kailangan sabihan na si Ma'am Rochi, gawin na silang member lahat.
Kailangan po
So ikaw
mag-PITAC
naman ang
certified po kayo.
nag-decide.
Opo. Okay.
Siya
Kailangan
po
po
talaga
PITAC
ang actual
certified.
head. Tingnan nyo,
Okay.
Sabado nasa clinic pa.
Oo nga po. May pasyente pa kanina.
O sige, sige.
Sunday po, open din po kami. So, we
Oh,
have
diba?
clinics Monday to Sunday, except for Thursday. Yan po ang
Yes.
pahinga ko, Thursday.
Oo,
Thank
day
you
off
po.
niya yun. Yun lang yung day off niya.
Opo. Na-under kami sa PITAC
Yes.
building. Opo. Sa East Avenue Medical Center. Malapit po kami sa East Avenue Medical Center. Yun.
Yes. Thank you very
Ang-
much. The future president of PAI.
Ay, wow. Hindi naman po.
Thank you po.
po. Kayo lang po yun.
Ay,
Opo.
let's
Thank
go.
you.
Okay, thank you po. Any questions? Wala na po. Okay, that will only mean either of two things. They were happy with number one, they were happy with what was presented. Or second, they are not happy because they didn't learn anything. Saan po tayo?
We're happy, Doc. Libre. Hindi. Ano talaga po, maganda po.
Ay, magkaibigan lang talaga tayo, Ma'am Letty, ha? Magkakampi pa. Okay, sige, go.
Happy lang, happy. Libre.
Happy lang, di ba? Wala yata
Okay.
yung... Okay. Okay na. So parang puro na lang tayo ano. So, Dr. Ryan, would you like to say something pa? I think we've covered enough. Mayroong comment. Ma'am Letty, this is for you.
Ano po yun?
Ikaw na mag-decide niyan.
Ano na sabi ko?
It would be great if the membership is open to all. Those who are still undergoing training. Ganyan naman dati, di ba?
Opo. Problem po ng Board of Trustees yan.
Pero ako, no
Hindi po ako
Pwede-
Board of Trustees.
Pwede may associate member yung those are interested but they're working on their sana.
Yes. I think
Anyway.
Meron po dati yan. Opo.
we're working on that.
Opo.
All I can say is that just to thank everybody that attended and also try to learn something new every day. It could be really, really valuable. And then for the rest of the weekend, a good rest of the weekend to everyone and happy Sunday.
Thank you very much for joining. Enjoy the...
Convention, Doc!
Ay, oo nga po. Sige. Talagang...
October 26!
Yeah.
Face-to-face po tayo. Opo.
Oo, sa
Gandahan niyo mga
Okay.
costume niyo, ganyan. Ay,
Oo. Sabihin mo na yung venue para mag-check-in na sila dun sa yung maraming
ano po, wala pang final.
mga
Baka malagot
taga-probinsya.
po ako.
Ay, nandito
Opo.
pala yung mga taga Tuguegarao. I saw
Tuguegarao?
from the DOH.
October 26, mag-book na po kayo. Sa
Opo.
Quezon City po tayo.
Oo,
Opo.
magdodoble na yung presyo.
Opo. Yung nyo, para makamura po kayo sa fare.
Yes. So next month ilalabas na ni Ma'am Leticia yung So
Opo.
magkita-kita po tayo doon sa October 26, that's a Saturday. It's a one-day
Event.
convention, yeah,
Opo.
with food.
Opo. Quezon City. Opo. Quezon City, one day,
Is,
9 to 6. Opo.
ano ba yung
Ano
hotel?
po? Doc, ano pa po? Pag-uusapan pa. Hindi pa
Pag-uusapan. Okay, sige, go.
Opo. Thank you po. Basta Quezon City po, mag-book na po kayo. Yung October 26, last Saturday of October. Final na po yun.
Okay, thank you po. So we hope to see you again soon, next week.
Yes, open to all. Open to all.
Yes.
Ma'am Evelyn.
Yeah. Yeah, Ma'am Evelyn is the one from
Tugigaraw.
Maraming salamat po. See you again next week. Thank you to our very
Si Dr. Gabriel.
excellent moderator, Dr. Ryan.
You're welcome po.
Okay.
Everyone have a good evening.
Thank you so much.
Thank you po.
Have a great weekend.
Thank you, Doc.
Thank you.
Thank you
Thank you po.
Thank you po.
Thank you. Bye-bye po.
Thank you for the knowledge.
Thank you po, Sir Denchen.